Hi, Mr. and Mrs. Smith. So the doctor told me that you guys get to go home today. So I just wanted to teach you a little bit about that catheter. So when you go home, you guys feel comfortable taking care of it and cleaning it. Okay? So I think the best thing to do is kind of start you off with the bag that you will be wearing the majority of the time at home. So this is the bag that if your feet are going to be above your waist, this is the bag that you need to have on. Your bladder is going to drain into this tube and it's going to follow gravity. So the bag that is your feet, if you're sitting in your easy chair at home and your feet are up, this bag needs to be on instead of the leg bag I'll teach you about in a few minutes. But the first thing I want to show you guys is how you're going to empty this bag, okay? So if you see here, you've got this little pinching system right here. You're going to want to pinch this tightly and it'll pull out of its little docking house. And that's all this is a docking house. So to actually open and empty the bag, we are going to flip this right here and it opens. You'll be able to expel the urine, and when you're done, you need to push it shut just like that. And you'll hear that click and you'll feel it too. And then when you're done, the tube needs to go right back into its home. So keep in mind, I just call this a home. If you do not shut this, you will have urine that will leak in the home. So please make sure you click this shut when you are finished emptying it. Okay? Any questions over how to empty this? Okay. So when you're home, you need to make sure that your catheter, again, this bag, is below your waist. So that way the urine will drain out appropriately. Okay? Good with that? So we also secure this bag on your leg. You have a leg strap on now, but I'm going to show you on my leg how this works, and that it's pretty easy to take care of by yourself, Mr. Smith. So the strap is going to go right above your thigh, right in this area is where we're going to want you to have that strap on your leg. Every day you need to switch spots of the strap so that you don't get any sores, and it also moves the catheter around and helps with the drainage and helps also decrease the soreness that you might experience while you have that catheter in place. So on this bag, you have a blue port. You see how the blue port matches this lovely blue strap? They are going to go together when you're at home. So when you're at home, this blue strap, your blue port goes right in there. Your blue strap wraps around and under. You pull it tight and it secures that catheter on your leg so you don't have movement that's going to disrupt your urethra. Okay, so it helps prevent any damage, keeps everything where it needs to be. Any questions over securing that? You guys feel comfortable? Okay, so what I like to do for my patients is I like to just take this off and leave it this way in your bag, so it's also just another refresher when you get home that this is how you will use this. Okay, so we'll put this bag aside. Again, this bag is used while we're sleeping, while our feet are above our waist, so that way we have that good drainage. Now, the other bag that we have is a leg bag, and that's this bag right here. This system is a little different when you empty. So the thing I like to tell patients is, again, you just have another home. This little cap at the end. This, again, does not stop urinary flow. It is just simply there for sanitation reasons. But while you have this on, if you notice that this is like this, it kind of looks like a foot. That means your foot's going to get wet because the system is open. This is a closed system. Thumbs up, we're good. So its system is closed. So this is how we drain this system. Okay? So this system you're going to use when you're up moving around, you need to go to your doctor's appointments, you need to go to the grocery store, keep in mind this bag is much smaller and holds a lot less urine than the large bag. So if you're going to be going on an outing, please plan on needing to empty this because you're going to need to, okay? The other thing with this system is it has different leg straps, and once I hook it onto you, I will show you how to actually use these straps, okay? So we need to actually get a few things ready while we change over the catheter, and this is something that you guys are going to do at home. So anytime you're going to mess with your catheter, you need to wash and dry your hands with soap and water, okay? So we're going to do that. And wash and dry your hands. I'm going to apply gloves today. At home you don't need to do this, but since I'm here, I'm going to do it for you today. I generally grab a washcloth. You're going to need alcohol wipes, and then whichever system that you're going to trade over to. So today I'm going to switch it to the leg bag since we're going home and show you how to do that. So as you see, you already have your leg strap on for your catheter at home, and now I'm going to show you how to switch this over. So the first thing that I generally do is I go ahead and unhook this strap. You're going to unhook this blue portion. You can leave this strap there though, because you're going to use it to secure the upper portion of your catheter, because when you have the leg bag on, the securement system is down lower on your leg. This will keep you stabilized at the top, okay? So after you've done that, you can just put a towel in place, just in case you accidentally dribble a little urine, it'll catch it for you. And one really important thing is anytime you are going to place anything within this system, you need to clean the end going in with alcohol, okay? So you just take an alcohol wipe and you rub with some friction right around the tubing, just like so. And then you're going to pinch this here, use this thumb, and push this system up. And you just walk it up until they are released. Take your hand, push your new system in place. Okay? Okay. So, as you see, with the other system we had a blue port, and with our leg bag we do not have that blue port on this system. So securing it's going to be just a little different. You're going to lift this strap up. You're going to place your catheter in it, and then secure it just like such. Now, this is not as secure as the other bag. There is no specific port, so it can move a little bit. So be precautious. Don't wear tight pants. Wear some loose-fitting clothing when you do this, okay? If you notice any tugging, you do need to just investigate really quick and make sure that your strap has not moved down or up your leg, okay? Questions over that part? Okay, perfect. So to secure your leg strap on the lower part of your leg, we have these straps here. There's elastic on this portion here, and that's the piece that you actually want against the skin so that it can grab the skin and secure itself. And you just slide this button in, just like so, wrap around the leg, secure the button, and cinch the ends for tightness, okay? You'll do the same thing down here at the bottom. Excuse me. Around. Cinch the ends for tightness. A lot of patients, I actually do have cut a little bit of this elastic off because if it gets down too far, it can actually be a tripping hazard, and that's the last thing you need. So you can trim that with scissors once we've stood you up and make sure that this is fitting in the right spot. You can just trim it with scissors. I don't say get too close, but you can trim about that much off of each end and still have an appropriate system. Okay, and again, with this system, you do not want to be laying down because the gravity is working completely against what we have going on. Okay, so twice a day and after every single bowel movement, you're going to need to do what's called catheter care. So when you do that, you use like a mild soap and water. I don't suggest anything with fragrance because you are kind of open, and some people do get some irritation with that. So twice a day, you're going to use good soapy wash rag, and you're going to clean the area very well. Soap and water. Get rid of that rag. Then you're going to rinse the same area, okay, with a new rag or your fingers, whichever you prefer. Get them good and soapy, or the rag good and soapy, and scrub the tube. Hold the tube in place with one hand, scrub with the soapy fingers, and the most important thing during this is you are scrubbing away from your body, because this is an open reservoir for bacteria, so you need to get those away. After you've scrubbed, you rinse it real good. You come in with your towel, you pat everything dry, and that's that. Any questions over any of that? Okay. I'm also going to send you home with this container. This is a container that you can use to empty your urine in. Once you're done, you empty your urine, you kind of get an idea of where you're at. You don't have to measure exactly, but if you're emptying so often, you kind of get to notice how much is coming out. If that drastically changes, you need to get a hold of your doctor. You'll also be able to smell if you have any sort of urinary symptoms coming on. A lot of times your urine can get some smell to it. If you notice that, you need to call your doctor. Also, if you notice that your urine was this beautiful yellow color that you're leaving with, nice and clear, all of a sudden it's kind of dark, less of it, you notice large blood clots or bright red blood, you need to call us. A lot of patients with hematuria still can have some small blood clots that are going to go through, and that's okay as long as you are not feeling the pressure in your bladder and they are moving throughout. Okay? Other reasons to call your doctor: fever, chills, nausea, vomiting, or pain that's uncontrolled with any sort of Tylenol or ibuprofen. Any questions? Okay. Good luck, and thanks for letting me take care of you. If you have any questions, you can call the nurse's station or you can call your doctor's office. Okay, now that we have went over how to take care of this catheter, I just want to tell you some general guidelines to kind of help you through this process. One of the things you need to make sure, again, it's really important that the bag of your catheter is always below your bladder. It all works by gravity, so if your bag is up higher than your bladder, the urine's not going to flow out, which can cause some issues for you. There are things that are called bladder spasms. Some patients experience them, some people do not. But if you get some tightness down in your lower abdomen that's not relieved by Tylenol, you need to call your doctor and they can prescribe you a medication that can help with those spasms. When you do have spasms, a lot of people do experience a little bit of leakage of urine around the catheter area. That is one of the telltale signs of a bladder spasm. So call your doctor and they can prescribe you some medication for that, because there's no reason to be uncomfortable with this. Another thing that is kind of expected is some patients do have a mucousy or bloody discharge right at the end of where the catheter inserts into their body. This discharge is normal. So don't be concerned if it happens. Just make sure that you are cleaning that area, getting all of that discharge off. And sometimes that's where it's helpful to use your fingers when you're cleaning, because you can feel that discharge a little better with your fingers than you will with a washcloth. Always make sure that your hands are clean when you're messing with your catheter. That's really important as well. Another thing is when you are sitting at home, this tubing needs to be free of kinks. So this needs to be a nice flowing system that does not have any kinks in it. So, you want to make sure if you have excess, you kind of make a loop of it so that there's no urine that's being pinched and backing up into your system. So that's also something that's pretty important and pretty easy to take care of. Just you can bring it down farther and you can make a loop if you have too much of the actual tubing. Again, we do want you to call your doctor. If you have fever, some chills, nausea, vomiting, your general something's just not right, I don't feel well. Pain that's uncontrolled by the medication that we're telling you to take is also a good reason to call your doctor. If you notice any smelly drainage, your drainage is getting darker, so your urine goes from a nice pretty yellow to a darker brown, or you notice any bright red frank blood in your urine, that is also another reason to call. Any questions? Okay, thank you guys. I appreciate you letting me take care of you, and good luck.